Hello, my name is Charlotte, and the topic I chose was the impact of food insecurity in rural America. I chose this topic because I wanted to learn more about why people don't have enough food to eat when I see crops rotting in fields every day in my community. Rural America typically represents living in the country with a white picket fence, green grass, beautiful flowers, and a family. Yet, food insecurity is real for millions of households living in rural America. Families living in rural areas where crops are grown don't have enough to eat and face food insecurity. With an abundance of food grown in rural areas, inadequate access and affordability to nutritious food should not be factors contributing to the mental and physical impacts of hunger. The United States Department of Agriculture defined food security as access by all people at all times to enough food for an active, healthy life. It is hard to believe that people in rural and farm communities who work hard to grow food that Americans depend on are food insecure. Feeding America, the largest hunger relief organization, nationally reported 2.7 million rural households face hunger. Families in rural areas find it difficult to receive food assistance from food pantries or food banks due to transportation issues, unemployment, or low wages. Children who experience hunger are often weak and suffer from childhood diseases because their immune system cannot fight off illnesses. According to the study of Feeding America and the National Foundation of End Senior Hunger, senior citizens must often choose between either buying food or paying medical bills. Research conducted by the American Association of Retired People Foundation indicated that over 10 million adults 50 and older are at risk of hunger. The National Coalition for the Homeless reported that the economic crisis in 2008 increased the number of households who faced food insecurity. The report revealed that hunger and food insecurity are linked to poverty. Causes of poverty stem from unemployment, high housing costs, low wages, and lack of access to food stamps, and medical and health costs. Unemployment due to layoffs, job closings, and job availability result in food insecurity. Gaining access to healthy and affordable food can be a challenge for rural residents in many rural areas do not have local grocery stores close to their home or considered food deserts. To improve food accessibility in rural America, numerous programs have been implemented to address the issues of hunger and food insecurity, including farmers markets, food stamps, supplement programs, and food pantries. The Women, Infants, and Children program, also known as WIC, provides a farmers market nutrition program for low-income, pregnant, and postpartum women with coupons or electronic benefits to buy fresh produce from farmers markets. Community food banks and food pantries are located throughout America and provide free food to individuals. The Meals on Wheels and Backpack Pals are other programs that help in your rural area and is a partnership between the food bank in Central and Eastern North Carolina, local food banks, and public schools to supply nutritious needs of children at risk and hunger during the weekends. House Farm Bill, the bill contains changes that would cause more than 1 million low-income families and households with more than 2 million people particularly low-income working families with children, to lose their food stamps and benefits will be reduced. Food banks and food pantries in rural areas find it hard to keep up with the increased number of individuals needing food assistance. As food insecurity increases in rural America, solutions must be found to alleviate hunger. As an American, individuals can help by volunteering your time and resources to local food banks and community food pantries. Dollars, regardless of the amount, can make a difference in feeding hungry families.